Am I the only one that didn't know just how many CDC experts have quit this year? It's not just a handful of people quietly leaving their jobs. This is a mass exodus, and it's happening right under our noses. The Centers for Disease Control and Prevention, the very agency we rely on to keep us safe from everything from pandemics to food poisoning, is facing a crisis of confidence and capacity. If you haven't heard about this, you're not alone. The story has been buried under other headlines, but the consequences could touch every single American. It's not just a few resignations. America's disease defense is unraveling. Imagine walking into an office that once buzzed with activity, only to find row after row of empty desks. That's the reality at the CDC right now. The people who have dedicated their lives to tracking viruses, investigating outbreaks, and developing life-saving guidelines are leaving in droves. And it's not just the numbers that are alarming, it's who is leaving. We're talking about some of the brightest minds in public health, people with decades of experience who are now walking away. Here's why that should worry all of us. In just the past 6 months, the CDC has lost thousands of employees, including top scientists and leaders. These aren't just paper pushers or bureaucrats. These are the epidemiologists who track the spread of new diseases, the virologists who study how viruses mutate, and the public health experts who coordinate responses to everything from measles outbreaks to bioterrorism threats. When these people leave, they take with them years, sometimes decades of institutional knowledge. That's not something you can replace overnight. This wave of resignations follows the ousting of new director Susan Monarez and the departure of respected figures like Deborah Howry. These aren't just names on a list. They're leaders who have steered the CDC through some of the toughest public health challenges in recent memory. Their sudden exits have sent shockwaves through the agency, leaving many to wonder who will step up to fill the void. The loss of such high-profile leaders is a red flag, signaling deeper problems within the organization. As Howry warned, if Monarez leaves, we don't have scientific leadership anymore. That's not just an internal squabble, it's a warning to the entire country. Scientific leadership is what keeps the CDC grounded in evidence, able to respond quickly and effectively to new threats. Without it, the agency risks becoming rudderless, unable to fulfill its mission. The departure of these leaders isn't just a loss for the CDC, it's a loss for all of us who depend on their expertise. The CDC isn't just another government agency, it's the backbone of America's public health system, the first line of defense against invisible threats that can upend our lives in an instant. When the CDC falters, it's not just bureaucratic drama, it's a direct threat to our safety and well-being. Why does this matter? Because the CDC's work touches every aspect of our lives, often in ways we don't even realize. From the vaccines our children receive, to the food we eat, to the air we breathe, the CDC is constantly working behind the scenes to keep us safe. The CDC is our first line of defense against health threats, from flu outbreaks to foodborne illnesses. When you get a flu shot, when you hear about a food recall, or when you see public health alerts about new diseases, that's the CDC at work. Their scientists are the ones who identify new threats, develop strategies to contain them, and communicate vital information to the public. Without a fully staffed and well-funded CDC, our ability to respond to these threats is severely compromised. But with half its budget and contracts slashed, its power to protect us is shrinking fast. The CDC's budget has been gutted, with billions of dollars in funding cut or frozen. This means fewer resources for disease surveillance, fewer staff to investigate outbreaks, and less capacity to respond to emergencies. Contracts with outside experts and labs have been canceled, leaving critical gaps in our public health infrastructure. The agency is being asked to do more with less, and the cracks are starting to show. Dr. Dimitra Daskalakis, a former CDC official, says the agency is badly wounded and fast losing its legitimacy. When respected insiders start sounding the alarm, we should all pay attention. The CDC's credibility is its most important asset. If the public loses trust in the agency, people may stop following its guidance, putting us all at greater risk. We're already seeing the impacts. Mississippi's infant mortality rate has spiked, partly because CDC-supported programs were halted. This isn't just a statistic, it's a tragedy for families and communities. When the CDC can't support state and local health departments, the most vulnerable among us pay the price. Programs that once provided critical support for mothers and babies have been cut, leading to real-world consequences that can't be ignored. And a recent analysis warns that proposed budget cuts could wipe out 42,000 jobs and slash $5.4 billion from state economies. These aren't just numbers on a spreadsheet, They represent livelihoods, families, and communities that depend on public health funding. When the CDC's budget is slashed, it's not just scientists who lose their jobs, it's nurses, lab technicians, data analysts, and countless others who play a vital role in keeping us safe. Political interference is also a concern. Since taking office, Health Secretary Robert F. Kennedy Jr. has questioned vaccine safety and cut funding for research. This isn't just a policy debate, it's a fundamental shift in how we approach public health. When political leaders undermine scientific consensus and restrict funding for research, it sends a chilling message to scientists and public health professionals. It creates an environment of fear and uncertainty, making it even harder for the CDC to do its job. Public health experts say this isn't reform, it's an assault on the CDC's mission. The agency was created to protect Americans from health threats, not to serve political agendas. When experts are sidelined and science is ignored, we all suffer. The CDC's ability to respond to new threats depends on its independence and its commitment to evidence-based decision-making. Undermining that foundation puts us all at risk. The bottom line? The CDC is in crisis and the stakes couldn't be higher. If we allow this situation to continue, we risk losing one of our most important tools for protecting public health. America's ability to fight disease outbreaks is at risk. We've seen what happens when public health systems are overwhelmed: delayed responses, preventable deaths, and widespread fear. The CDC has always been the agency we turn to in times of crisis. If it can't function effectively, we're all more vulnerable to the next pandemic, the next foodborne illness, or the next bioterrorism threat. Experts warn that if we don't act now, the damage could be permanent. Once experienced scientists and leaders leave, it's incredibly difficult to bring them back. The loss of institutional knowledge, the erosion of public trust, and the weakening of our public health infrastructure could take years, if not decades, to repair. We can't afford to wait until the next crisis to realize what we've lost. Stay informed, support science, and demand accountability, because public health affects us all. The choices we make today will determine how well we're able to respond to the health threats of tomorrow. It's up to all of us to speak out, to support the scientists and public health professionals who work tirelessly to keep us safe, and to hold our leaders accountable for the decisions they make. Our health, our safety, and our future depend on it.